The John and Myrna Daniels Foundation is honored to be part of this historic moment in global healthcare. The development of the Myrna Daniels Seniors Emergency Medicine Center will build on UHN's strong commitment and cement their role as a national leader in caring for older adults. We know how critical exceptional emergency medical care is for our aging population. And with this gift, we're proud to help set the gold standard nationally and globally for a revolutionary model of geriatric patient care.
My mother has been a patient here for almost 25 years now. She has cardiac issues. Because I have a lot of experience running to the ED, I see what happens with staff. They're busy. Someone else is coming in with chest pains. Someone else is coming in that they can't breathe. So I see that going on, and I see that they're pulled in a lot of different directions. I see sometimes in her eyes when the doctor's speaking to her, her vulnerability. Sometimes her eyes water. She didn't understand what he just said. And I see the fear. It's hard to see a parent becoming more vulnerable, slower in terms of her movement and retaining information. What I heard is they said geriatric emergency department. And I said, I'm there. Why wasn't this done before? Oh, it was a relief. And to hear that UHN is doing it is even a bigger relief, because where else could it succeed?
The program has three main components. The first is an improved clinical care for older adults by providing multidisciplinary care by physiotherapists, social workers, occupational therapists, as well as physicians and nurses in a dedicated space, one of the only of its kind in the world, that's designed around improving care of older adults in terms of safety, in terms of accessibility, efficiency, but also a welcoming environment that makes people feel that they can participate in their care. The other component is education. So this is shaping future generations of nurses, physicians, and other allied health providers to provide optimal care for older adults. And the third component is research. So UHN is already a global leader in research. And the idea here is to drive a forward-thinking, innovative program in research that will elevate care and hopefully not just create research, but drive that knowledge out to other places where it can be used to make life better for older adults.
The people that are attracted to working in an emergency department are truly, I think, the most resilient and flexible people in the organization. When you work in a busy emergency department, as we have at both Toronto General and Toronto Western site, you never know what might come through the door. We could see the most acute patients in a life-threatening state, and we can also see individuals that are coming because they don't have other mechanisms for healthcare. They may not have a GP, they may have a very basic need, but an important need for them. And the staff that work in that department make everyone feel important, feel valued, and attend to their needs.
In other parts of the hospital, you have more time to spend with your patients, interact, build relationships. In the emergency department, people are here for a shorter period of time, in a more acute state, with more fears, with more anxieties, with the fear of the unknown. So it's really crucial in that time that as a healthcare team, for us to be able to really make a difference, make the impact, and have those connections. So they may be very brief connections that we have with our patients, but they can be often the most important connections.
It's very fearful for us to go to the hospital and know that anything could happen. It's very busy. I could fall, I could anything, really. How long I will be waiting there. There is no wall, there is no privacy. It was very anxiety provoking. Another time, I was really admitted to the hospital, and I was in emerge for a long time, just lying there in a really uncomfortable bed. It was very noisy, and nobody came for a long time. This is what happens in the emergency when, especially when people are older patients. They come older, they are frail more. They have more than just one condition. I have a chronic pain for years, heart condition. So there are different medical conditions that I needed to be looked at, but there's no time, everything's fast.
I would like to help those seniors who are vulnerable, and some of them without families, without support. They do need the most help to be able to function in the community.
I was telling someone the other day that working at UHM is like dreaming out loud. I always thought that we needed to have a streamlined way to deal and address the issues of our seniors that come into the ED. I want our patients to have like rapid access to the care that they need, and this will help that.
I came into the emergency department one morning at 7 and found an elderly couple in our hallway. The patient was the wife, and she was on the stretcher, and the elderly gentleman was sleeping on a bedsheet on the floor. I went to check on him, and he told me that his wife had been there for several hours and that they had been married for 40+ years. He's never left her side in those 40 years, and that he wasn't about to start now. That really, really hit me hard, because not only was it horrible that he had to sleep on the floor, the fact that so many people were passing by this person and saw him sleeping on the floor spoke to me of how desensitized we become to these issues in the emergency department. So really back then, I made a commitment to myself to do everything I can to help our older patients in the emergency department. That wasn't right, and it should not happen.
There was an incredible synergy of Myrna, who had a dream to have an emergency center for seniors, and it was based on a lot of her own personal experience, and Sam Saba, who had a great ambition to develop this as a program, and putting the two of them together was just like magic, actually. So it really was simultaneous with Sam having an ambition to develop this and a donor who had an incredible passion for developing a center for seniors.
With this gift, you are touching the lives of those individuals who built Canada, on whose shoulders we stand. And I want to say a sincere thank you. Your wish will be brought to fruition, and every day will ensure that this investment generates what you expect: better care for seniors.
We have amazing nurses and doctors that work in this hospital, and the Canadian public has no clue how lucky they are. There's a reason we're the #4 hospital in the world, because we are the best at what we do. Myrna, Jack, you guys are incredible. Your philanthropic activities on behalf of UHN have been nothing short of incredible. You are one in a million. We love you, and we wish you only the best.
Having gone through some not-so-grand experiences in emergency rooms, that's really what prompted me. Many years ago, having had to visit emergency rooms and seeing how poorly they were run, it was an eye-opener. You have to remember that our seniors, they really worked. They were not spoiled. Whatever they achieved through their own ability and their own determination and sacrifice. A lot of it was sacrifice for the next generation. And we reap the benefits of that. Why not appreciate that and have a difficult time of their life made a little bit easier? Whatever you can do to help somebody who really may not be able to reach out to help themselves, it's a blessing. This is the best place to do it. We have a growing city. It's growing by leaps and bounds. There are going to be more and more elderly people. And it's a city that is open to experiments and new ideas. When I mentioned it very offhandedly, I got such a warm reception to the idea that it encouraged me to go on, and it encouraged me to be here and work with these people who are so excited about the idea. There's nothing that's more energizing than have people agree with you.